Good afternoon. Thank you for joining the Alabama Medicaid Agency's ACHN webinar. Today's topic is patient attribution, enrollment, and maternity care. My name is Melanie Cleveland, Director of Communications, and the purpose of today's webinar is to provide an overview of ACHN changes effective October 1st, 2024. I'd like to introduce our speakers today. First, we'll hear from Courtney Hanson, Managing Director of the Institute of Data and Analytics at the University of Alabama. And we'll also hear from Dr. Travis Hauser, Director of the Department of Health Systems at Alabama Medicaid. As we get started, I have some housekeeping items to go over. All participants who have joined us by phone or through WebEx are muted. Please do not unmute your phone or your microphone during the presentation to avoid disrupting the presenter. You will have opportunities to enter questions into the chat box in the WebEx, and you can also email questions to the agency at achn@medicaid.alabama.gov. The program areas will review questions submitted, and they will post responses on the ACHN provider's webpage. To find this page, you'll visit www.medicaid.alabama.gov. You'll select the ACHN tab, and then you'll select ACHN providers from the drop-down menu. All ACHN webinars are being recorded, and they will be posted on the ACHN providers webpage. Please record your attendance at this time if you have not already done so by entering your name and the organization that you represent in the chat box. If you joined us by phone, you can email your attendance to achn@medicaid.alabama.gov. And I will now turn it over to Dr. Hauser and Courtney for the presentation.
Thank you, Melanie, and good afternoon, everyone. My name is Travis Hauser, and I'm the Health Systems Director for the Department of Health Systems at the Alabama Medicaid Agency. Today, I will go over the ACHN provider agreements, the purpose of those ACHN agreements, the enrollment and effective dates, provider participation and updates, and maternity care updates. There are three types of ACHN agreements. The first one is the Alabama Primary Care Physician Group Agreement, which is an enrollment agreement between the Alabama Medicaid Agency and the participating PCP group. The second enrollment agreement is the Primary Care Physician Group Network Participation Agreement. That agreement is between the PCP group and your participating ACHN. And the third participating ACHN agreement is the Maternity Care Provider Network Participation Agreement. That is the agreement between the maternity care provider and the ACHN in your region. The purpose of these ACHN agreements for the PCP groups, number one, for the agency is to serve as a contract between the agency and the primary care physician or maternal care provider group. There are certain participation requirements that you have to adhere to in order to maintain that agreement with the agency. For PCP groups, you have to have 2 enrollment agreements beyond your regular Medicaid enrollment agreement to be eligible for ACHN participation rates and bonus payments. Those 2 agreements are the Medicaid PCP group agreement, which again is the agreement between the PCP group and the Medicaid agency. And you also must have an enrollment agreement with the PCP group network participation agreement with your ACHN. Maternal care providers, formerly known as DHCPs or delivering healthcare providers, in order to be eligible to receive reimbursement for maternity services and maternity bonus payments, you must sign an ACHN agreement with your regional network, the MCP Group Network Participation Agreement. The PCP Group Enrollment Agreement, there are certain provider types that are eligible to participate with the ACHNs. Those are family practitioners, general practitioners, pediatricians, OBGYNs, internal medicine, federally qualified health centers or FQHCs, rural health clinics or RHCs, And we will accept others upon the agency review if you're willing to participate and adhere to the requirements of that agreement. Some of those agreements are the EPSDT requirement, in which we'll go over a little bit later, the hospital admitting privileges requirement, and the 24/7 coverage requirement. In regards to the network participation agreement with your regional ACHN, there are also some requirements that you must maintain with them, those being active participation, comply with the ACHN policies and procedures, allow access to medical records, collaborate with the ACHN pharmacists, and provide access to care. The PCP groups agrees to do the following. You must enter into a participation agreement with the agency and complete and maintain the following requirements. The first one, as I mentioned earlier, is the 24/7 requirement. All participating PCP provider groups must have 24 hours, 7 days a week coverage for their telephone services. You can adhere to this requirement by hiring an outside firm to answer your calls after hours. However, those calls must be returned by a clinician within 1 hour. You can also set a voicemail on your answering service. And again, you have to return those calls within 1 hour. Automatic referral to the hospital emergency room is not acceptable for this requirement. Providers must be able to administer EPSDT screenings or collaborate with another provider to provide those EPSDT screenings on their behalf. In addition, you also must have hospital admitting privileges, or you can collaborate with another provider to admit those patients on your behalf. For more information, you may refer to Chapter 40 of the Provider Billing Manual, which will be updated on October 1st, 2024. The PCP group will also collaborate with their ACHNs. In order to be considered actively participating, you must attend over a 12-month period 3 quarterly medical management meetings with the local or regional ACHN medical director. You must also engage in ACHN initiatives centered around quality measures. You must do a data review with the ACHNs to help achieve agency and ACHN quality goals, and engage as appropriate with the ACHN with the multidisciplinary care teams, or MCTs, for the development of an individualized and comprehensive care plan. Bonus payment opportunities. The reward for actively participating with the ACHN is bonus payment opportunities. There are 3 bonus payment opportunities for participating ACHN providers. The first one being the quality bonus payment, which is worth 50% of the bonus pool. Effective October the 1st, it will be based on attribution for a specific time period. We will discuss that later next week. And quality measure scorecards are available quarterly so that you can review those on a quarterly basis. Your cost effectiveness bonus payment is 45% of the bonus pool. Those will be calculated based on the attributed recipient's risk scores and associated costs. You must meet a threshold below or medium of the threshold, And also cost effectiveness cards are available quarterly. Patient-centered medical home, or PCMH, is 5% of the bonus pool. You must achieve annual attestation on an annual basis to the Medicaid agency no later than October the 1st. If you have not received PCMH recognition, the agency will review your progress to determine if you have made adequate progress towards PCMH recognition. Similar how we did in the 2019 contract, we will do a reserve pool for the ACHN bonus payments. Currently, the bonus pool is for $15 million, and we will distribute that quarterly. but we will reserve $100,000 per quarter and will pay the remaining funds out in the fourth quarter. The reasoning for this reserve is so that we can offset any bonus payment issues we have during the year. And again, any leftover funds will be paid to eligible providers during the fourth quarter. So how to enroll in the ACHN? For PCP groups, number one, you have to have an initial Medicaid enrollment. Meaning you have to go through the web portal and enroll as a Medicaid provider, whether you're a physician, OBGYN, FQAC, etc. Once you have gotten your welcome letter from the physical agent, you can request or go to our website to download our PCP group enrollment agreement so that you can begin the first application for ACHN enrollment. The second step is to contact your ACHN in your region to request a network participation agreement. You must have an agency agreement and a network participation agreement to be considered fully enrolled in the ACHN. Agreements received prior to the 15th of the month will have an effective date of the first month, considering that the agreement is error-free. An example of that, if we receive your agreement on September the 14th, your effective date will be October the 1st if there are no errors on the application. If the agreement is received on or after the 15th of the month, it will be the first day of the month following the next month. For the same example, if you submit the application on September the 15th, your effective date will now be November the 1st. Maternal care providers, or MCPs. In order to be reimbursed for maternity care services or be eligible for maternity care bonus payments, you must enroll as a Medicaid provider, as an OBGYN. And you must also contact the regional ACHN in your region and request an MCP group participation agreement. Again, you must have the MCP group enrollment agreement on file to be reimbursed for any of your maternity services. It's the same slide. All 2019 ACHN agreements will terminate on September 30th, 2024. You should have received a termination notice in the mail to your PCP group and your MCP group. All providers must submit a new 2024 ACHN agreement to Gainwell, our physical agent, prior to September the 15th for an October 1st effective date. Agreements received on or after September 15th will not be eligible for the October 24 bonus pool. Patient-centered medical home attestation. The agency is currently accepting FY25 PCMH attestation. Those are due annually to the agency, and for this year, they are due October 1st, 2024, to be eligible for the PCMH bonus payment for FY25. Again, the PCMH bonus is worth 5% of the bonus payment pool. You may download the attestation form at the link that's available on our website in the forms library. If you have any questions about the enrollment process, you may contact ACHN at medicaid.alabama.gov. If you need to contact someone at our physical agent, you may contact Melissa Gill, who's the provider enrollment supervisor, at melissa.gill@gainwelltechnologies.com. And you may also contact the Network Provider Assistance Unit, who's Pamela Durden and Patricia Tosin. Maternity care updates. Effective October the 1st, if you all have already noticed, we will no longer refer to our maternity care providers as delivering healthcare professionals. Instead, we will use simpler terms, which are maternity care providers or MCPs. MCPs will have an additional opportunity to earn additional postpartum bonus payments, and we'll talk about that in a few seconds. And then one major update, maternity care will move from Chapter 40 to Chapter 24 of the Provider Billing Manual effective October the 1st. MCP bonus payments. Effective October 1st, MCP bonus payments will consist of an increase by $100 for the postpartum bonus payment. The initial bonus payment, which is the H1000, will not be changed. It will continue to be $150 if you see the recipient within the last 90 days of the menstrual period. G9357, which is the postpartum bonus payment, again will increase from $150 to $250. However, we do have an additional bonus payment that we'll discuss now. During the first postpartum visit between 7 and 21 days will be worth $125, I'm sorry. MCP providers will have an opportunity to obtain an additional $125 by completing a second postpartum visit between 22 and 84 days. The first postpartum visit is not required to be eligible for the second postpartum visit. For example, if your first postpartum visit is day 25, you will receive the $125 for the second postpartum visit. If you do see the recipient for the first postpartum visit, to be eligible for the second postpartum visit, there must be a 14-day gap between the two visits. For instance, if you see the recipient on day 21 for the first postpartum visit, you will need to wait 14 days before you will be eligible for the second postpartum visits. Similar to all of the bonus payments, non-citizens are not eligible for the postpartum bonus payments, and a maximum of 2 postpartum bonus payments will be paid per Medicaid recipient per pregnancy. Nurse midwives will continue to be reimbursed at 80% of the physician's rate. And I highly recommend on October the 1st, when the new provider manual updates are out, please review Chapter 24 because there are specific billing requirements that you have to use in order to get the 2 postpartum bonus payments. For example, you will now have to use a modifier on those claims. If you don't use those modifiers, then you will get denial. So I highly encourage everyone to visit Chapter 24 when it is available on October the 1st. Program contacts. Again, I am Travis Hauser. I am the Health Systems Director for the Department of Health Systems. The Managed Care Providers and Health Clinics Unit, which consists of the Network Provider Assistance Unit. We have Patricia Tosin and Pamela Durden. And we have the Comprehensive Family Health Services Unit, our maternity care consultant, Ms. Linda White. Again, it's highly encouraged that you utilize Chapter 24 of the Provider Billing Manual for the maternity care services. And for the ACHN, primary care physicians, and ACHN entities billing, you would utilize Chapter 40. It's all going to be effective on October the 1st. If you have any questions about today's presentation, you may contact us at achn@medicaid.alabama.gov. I will now turn it over to Courtney Hanson, who will go over patient attribution.
Thank you, Dr. Hauser. So for this section, we're going to discuss what attribution is within the ACHN program, when attribution is used, and then we'll spend some time working through the attribution methodology, and we'll wrap it up by talking through how to request redetermination. So attribution is the process that will be used by Medicaid to associate a Medicaid recipient with a PCP group that is participating in ACHN. Once again, as a reminder, PCP groups must sign 2 agreements, one with Medicaid and one with the ACHN entity to participate in the ACHN program. Under the ACHN program, Medicaid recipients will be attributed to PCP groups based on historical claims utilization. The attribution process in general is very similar to what during the 2019 program. So for attribution, PCP groups are encouraged to continue seeing patients as medically necessary and as consistently as recommended by guidelines. And attribution will be a critical factor for determining the distribution of all the bonus payments among eligible providers in the ACHN program. So as a reminder, that's a quality measure bonus, the cost effectiveness bonus, and the PCMH bonus are all distributed according to attribution. And as a reminder, the bonuses are all paid at different with different retroactive look back claims experience. We will in the future we will be going into more detail about both the quality and cost effectiveness that looks back. But the more important part about this this visual right here is that there's a rolling 24-month look back associated with attribution. So walking through our guiding principles of the attribution methodology, the ACHN program, it has a guiding principle of paying for activity. There's continued emphasis on care coordination and health outcomes with a focus on preventative care. We are acknowledging that some recipients will require specialist care. And then we are also making sure to evaluate the activities at a group level, the PCP group level. So our key steps in attribution are including Medicaid recipients that have at least 3 out of the previous 24 months of eligibility. They are eligible for the ACHN program. So those 3 months do not have to be continuous within the past 24 months. So then we look at the previous 2-year history of face-to-face provider visits. We are looking at both preventative visits and regular office visits. Our preventative visits will have a higher point value. Our more recent visits will also have a higher point value. And then PCP visits have a higher point value than specialist visits. So it's all by points and we look back. We also look at the previous 12-month history of filled prescriptions for chronic care conditions. So the process is calculated on a quarterly basis, and Medicaid will determine attribution for each Medicaid recipient under the ACHN program. So we look at face-to-face visits and assign the point value. And then those individual provider scores will be combined to form the PCP group's total point score for each patient. The PCP group with the highest number of points will have the Medicaid recipient attributed to that PCP group. If a specialist group has the highest number of points, then the specialist group will be attributed the Medicaid recipient. So this chart is important. It shows the number of points and the points allocations according to whether the provider that saw the patient is a primary care or a primary care provider or a specialist, whether or not the visit was just a face-to-face visit or a preventative visit, and then how long ago during that 24-month look-back period the visit occurred. So as you can see, we have higher point values for primary care versus specialists, and we also have higher point values for preventative visits than for face-to-face visits. So in order to understand how this works, we will walk you through a few scenarios. As you can see, I would hope that you understand the names above don't represent actual members, providers, or provider groups in Alabama Medicaid. I mean, if Steven Seagal would like to see one of y'all, I'm sure you would be happy to have him. So in this example, Steven Seagal has seen 4 different providers across 2 different provider groups. So, and then 2 visits were made with Dr. Hardy, and 1 visit was made to 3 different providers in Gallagher Family Practice. So even though Steven Seagal saw Dr. Hardy twice, and he saw 3 other doctors as well, he saw more doctors at Gallagher Family Practice, which means that he would be attributed to Gallagher Family Practice. So this shows how we are evaluating at the group level. In our next scenario, the member has seen 3 different providers across 2 different provider groups. Those 2 most recent visits were to Bluebell Pediatrics, while the 3 older visits were to a different group. Although the different group has 3 whole visits, they were still so long ago that they have a lower score than the 2 more recent visits to Bluebell Pediatrics. And then finally, our last one shows that this member has seen 3 providers across 2 provider groups, with 1 provider belonging to both groups. So once again, Denny Duquette has seen Addison Montgomery 3 different times, but only 2 times was at Seaside Health and 1 time was at Gray Sloan. The member has also seen other people at Gray Sloan. So once all of these points are added up at the group level, the member will be attributed to Gray Sloan because Gray Sloan had more visits with more points than Seaside Health. So once again, the attribution process is run on a quarterly basis. And so when the PCP group receives their attribution report, they may request that the attribution calculation for any Medicaid recipient who has received care from the group within the previous 2-year period. So if that PCP group believes that the Medicaid has not properly attributed 1 or more Medicaid recipients to that group, the group may request Medicaid to reconsider the attribution calculation. A request for reconsideration must be submitted to Medicaid in writing and within 7 business days of the quarterly attribution notification. The written request must contain the period of attribution, the name of the Medicaid recipients that the PCP group believes was or was not properly attributed, and then supporting information or documentation demonstrating that Medicaid either failed or improperly considered information which had a material impact on the results of the attribution. The PCP group that was originally attributed the Medicaid recipient is also subject to request for reconsideration, and they shall be notified by Medicaid of the request and be permitted to submit information for Medicaid consideration within 3 business days of that notice. And then if the PCP group that was originally attributed the Medicaid recipients are subject to requests, the reconsideration does not respond to Medicaid within the 3-day time frame, Medicaid will continue without submitted information. So Medicaid will review all relevant information and complete any adjustments to the PCP group's Medicaid recipient attribution within 7 business days of receipt of the request for reconsideration. And contact information in order to complete this reconsideration process will be included in your quarterly attribution information and reports. Again, please submit any questions for official response to the email address below, the achn@medicaid.alabama.gov.
Thank you, Courtney and Travis. We appreciate the information. Again, we're not going to be addressing questions during today's session, but you can submit those questions either through the chat box or you can email them to the achn@medicaid.alabama.gov. The program areas will take some time to review these questions and they'll post some responses to these questions on the ACHN provider page. And for those that joined us a little later, I'm going to remind you of the pathway, how to find these Q&As for today's session. If you'll visit our website, www.medicaid.alabama.gov, select the ACHN tab from the top. You'll see a drop-down menu. Please select ACHN providers from that menu. And you'll see all of the information, including the recording of today's webinar on that page. Please remember to record your attendance today if you have not already done so in the chat box, or you can email achn@medicaid.alabama.gov. We thank you for your attendance today, and we hope you have a great afternoon.